I am an infectious disease doctor at the University of California, San Francisco, and I'm going to be talking a little bit about identifying COVID-19 outbreaks. I think the purpose of this is to sort of get you comfortable with the language and the general definitions. And I want to say as a caveat before we even start, outbreaks are very specific. They're specific to the context where they're occurring. And you'll kind of hear more about that as we go through the presentation. Okay, so our goals here today are to define what is an outbreak and the criteria used to establish the presence of a COVID-19 outbreak in different settings. And again, those settings are really important. Identifying the most common sources of data from which COVID-19 outbreaks can be detected, and then describing sites' COVID-19 reporting requirements, both to the California Department of Public Health, to local health departments, and to other agencies. Next slide. Okay, so I'm going to start by throwing out a question to you all, the audience. If you could respond in the chat, please. What is the definition of a COVID-19 case? Great, so I'm seeing a lot of confirmed positive PCR, positive RT-PCR. Yeah, someone testing positive. Great. Can we can, I think, probably move on to the next slide. Yeah, so a confirmed positive COVID-19 test, and usually that means a PCR test. And it's important to note that that case can be symptomatic and have a flu-like illness, fever, chills, cough, shortness of breath. Then the additional symptoms we know that can be associated with COVID: headache, new loss of taste or smell, GI symptoms like nausea, vomiting, diarrhea. But that person might also be completely asymptomatic. So, depending on what reference you look at, 17.9% was based on this early Japanese cruise ship data. Maybe up to 40% of people are actually asymptomatic. It does seem clear the more and more cases there are worldwide, that the majority of people, probably around 80%, have either a very mild course, like an upper respiratory infection, or are asymptomatic. So it is possible when you have identified a COVID-19 case through PCR testing that that person does not know that they're infected and does not feel ill. The other definition we should get out of the way is PUI, which stands for person under investigation. I would say that's been being used, I think, a little bit less now that the pandemic is so widespread and there are sort of active and robust contact investigations, but good terminology to know. Okay, next slide. Okay, so go back to the chat and you can let me know what you think the definition is for COVID-19 outbreak.
Well, it would be, is an outbreak defined similarly to how the epidemic, more cases would be expected?
Mm-hmm. Yeah, I'm seeing a lot of more cases than expected, higher than expected. Someone said 3 confirmed cases or more in one location. Good. Okay, so I want to say, just as an epidemiologist, so that the general definition of an outbreak is just what a lot of people have said here in the chat. So more than the expected number of cases at a particular location in a particular point in time. And so obviously to define that, you need to know what your baseline sort of case rate of a particular disease at a particular location is. But what we're gonna talk about sort of the general definition of a COVID-19 outbreak. And if you can move on to the next slide. The general definition of a COVID-19 outbreak is 3 or more contacts that are identified as having active COVID-19 that are identified either during a case investigation or contact tracing, or 3 or more individuals with COVID-19 that are discovered because they're linked because of a particular location. So generally, we think of people said in the chat, 3 confirmed cases in a particular location. I think that's a nice rule of thumb. But as we'll see in some of the follow-up slides, it really depends on the setting. So if you are in a really high-risk setting with people who are medically vulnerable at high risk of having severe COVID-19 disease, then that definition might change and the number of cases that you have to have might be lower. Okay, next slide. Okay, so outbreak definition in a residential congregate setting. And that sort of includes things that are thought to be, people are cohabiting, habitating, but it's not necessarily it's not a medical facility, and it's not a facility where a large number of medically vulnerable people are housed together. So places like dormitories for students, group homes, boarding houses, camps, which was a thing over the summer, barracks, shelters. They use kind of this more general definition, so at least 3 cases of laboratory confirmed COVID-19. And usually that occurs in the setting of 2 or more of cases of acute illness compatible with COVID-19. It can be in residence or in staff, and it also has to take place in a discrete period of time, so within a 14-day period. Next slide. Schools, I think, are important to think about. So the definition here is at least 3 probable or confirmed COVID-19 cases, again, within this 14-day period, in people who are epidemiologically linked in the setting. So in the setting of that school or workplace. Basically, you're thinking about people who their main connection, their main link is a school or workplace. They're not from the same household. They're not close contacts of each other for any other reason. So that 3-case definition holds for non-healthcare workplaces and schools. Okay, next. Okay, so when we move on to acute care hospitals and skilled nursing facilities, so these are the settings where there are a lot of people who are have medical comorbidities, usually are older, at higher risk of having severe COVID-19 disease. And because of that, our definition of an outbreak in that setting changes. So for skilled nursing and acute care hospitals, it really just 1 probable or confirmed COVID-19 case. And again, it can be in a resident or in a staff member, a healthcare provider in that setting constitutes an outbreak and constitutes something that needs to be followed up on. And you can, from your work in local public health that skilled nursing facilities are at huge risk. They have some of the most stringent requirements around, and we'll hopefully talk about this more, but around visitation, around routine screening of residents and staff members, around cohorting patients if people are symptomatic. So a lot of that is the thought going into that is to try to prevent outbreaks in this really vulnerable group. Okay, next slide. So these are some examples of outbreaks in different settings. 3 or more patients in a workplace that looks like an office setting that are discovered to have COVID-19 and are lab confirmed cases. 1 case identified in a shelter in the setting of 2 more people who are confirmed cases and are symptomatic. And then in the context of a school, a teacher in an elementary school who is test positive, and within the the week, 2 students also are testing positive. All kind of different examples of outbreaks that are occurring in different settings. Next slide. Okay, so I think we're gonna have a poll here. So how many confirmed cases of COVID-19 in a school or non-healthcare workplace? And again, those are kind of average risk. We think probably average risk populations are needed to meet the definition of an outbreak. So go ahead and respond. I'll give you just a couple more seconds. And yeah, I think it's okay to halt the poll. So the vast majority of you answered 3 or more, and I would agree with that, that in that setting where we have kind of an average risk population, we'd use the definition of 3 or more cases. Okay, next slide. Okay. Okay, so try to get rid of this poll. All right, so understanding COVID-19 surveillance, there are a couple parts that go into it. You know, at the most basic level, surveillance is monitoring disease activity at the local level, but, you know, I would argue probably most critically, but then also at the state and national level. And you are doing that by following up on all the tests that are performed and getting reports of positive tests, looking at trends and disease incidents and identifying kind of hotspots in your community where disease is occurring, by conducting disease control interventions. And I think we'll talk more in detail about these in future sessions, but by doing kind of the reporting back and then the follow-up investigations, if you do see those kind of hotspots or clusters of cases. And then finally, you know, a critical part of surveillance is trying to define the epidemiology and the burden of COVID-19. So just describing the spectrum of illness, the disease burden in your community, and the characteristics of the people who are infected or sick. Okay, next slide. This is a nice little schematic which talks about COVID-19 case surveillance and talks about all the different players that kind of are part of COVID-19 case surveillance. And I would, again, argue that local and state public health are right there in the middle, in the center of it all. If you're at a local health department, you're receiving case reporting from hospitals, from healthcare providers, from labs that are doing COVID-19 testing. And there's, you know, this notation at the bottom about identified data, you know, within the local public health jurisdiction and then the state. Often this is identified data with patient identifiers in it so that disease investigators can go back and do things like contact investigations and can follow up and intervene. And then you are, as a local or a state or territorial or tribal public health authority, reporting on your case information to the CDC and onwards to international organizations. And that data at that point is de-identified, so it doesn't include patient identifiers. Okay, next slide. In terms of what is required in terms of COVID-19 reporting, what is required is laboratory confirmed COVID-19 cases. Those are all counted in local and state epidemiology, and COVID-19 deaths are also really important for us to know about. Everything else is voluntary, or a lot of the other work that is going on currently at public health departments is voluntary in terms of eliciting contacts from cases, following contacts for new positive test results. Next slide. There are, based on the site, additional COVID-19 requirements. So you were talking about Tesla before. Workplaces are required to notify the local health department if they have 3 or more cases reported in a workplace within that 14-day window. So that's important for you to know. I think even if there are mechanisms in place for workplaces to do internal contact tracing, it is information that they must report to the local health department. Skilled nursing facilities, 3 cases of any acute illness that could be compatible with COVID-19 in residents within a relatively short time window that is required to be reported. And then in terms of the pediatric population, the CDC has asked that cases that meet the definition of multi-system inflammatory syndrome in children be reported within 1 working day. Next. Okay, so we're going to go back to the chat. If you could give me some ideas. So what kind of data sources or systems are used to detect outbreak? And I think we're asking here, how do you know, sitting in a public health department, that there's an outbreak going on? How is the information coming into you?
It's mandatory reporting.
Right. You can write in the chat what kind of different sources is the mandatory reporting coming from? Great. I'm seeing a lot of good answers. So I'm seeing from labs, from hospitals, CalConnect, great. Yes, these are all very good answers. Okay, we can move on to the next slide. Yeah, so how do we detect outbreaks? So, some of you were mentioning kind of the passive reporting that goes on. So those are basically reports when people call the local health department. Facilities, hospitals, providers are calling in with cases of COVID-19. Facilities maybe that are under monitoring if there's concern that there's an outbreak at a particular facility. That's sort of one set of ways that you might hear about an outbreak or suspect an outbreak. But the other is really, we have these disease monitoring systems in place that are kind of active surveillance, where we're asking people to report in about their cases. And that's another way you might know about an outbreak at a particular site. So people mentioned CalConnect and ComCare in the chat. That's great. And I hope that you are interfacing with those systems in your work right now. Okay, next slide. Site-specific monitoring. So this is kind of a nice example of a list that maybe a disease investigator at a local health department might have. So she might be keeping track of a couple different sites of interest where there are either confirmed COVID positive cases or suspected COVID cases with some tests pending. And it's a nice example of what kind of information you might track. So not only the location name and whether it's being actively investigated, but information about how many total have been tested, whether they're residents or staff, the date of the last positive, and then some notes about what kind of activities are planned and what kind of challenges are specific to that site. So this is, I think, just an example of a tool that you might be using if you are monitoring sites within your community. Next slide. Okay, and examples from data reporting. So this is how you might hear about an outbreak that is occurring, or might suspect that an outbreak is occurring within your community. So if you notice that 3 cases in your disease monitoring system are identified as having the same workplace, that might would trigger you, I think, to put that site on your list as a that workplace on your list as a site of potential outbreak. A person living in a shelter tests positive in preparation for routine surgery at the local hospital, and upon contact tracing, find that 2 other positive cases are in that shelter. So those, three cases within the same shelter, 2 that were discovered during contact tracing, would elicit you to follow up at that shelter and do some disease investigation there. And then the last example is more an example of passive reporting. So if somebody calls you from a workplace, calls the local Department of Public Health asking for guidance because 3 staff have tested positive for COVID-19. That's someone sort of calling you, directly reaching out, and another way that you might hear that there's an outbreak. Okay, next slide. Okay, so networks, people are linked by many factors: where they live, where they work, where they socialize. It's really important during outbreaks to try to figure out how people are connected. Next slide. Okay, we're going to do a quick Zoom poll. So is it an outbreak? So in this question, an 87-year-old resident of a skilled nursing facility is identified as a close contact of a case. So I'm assuming a confirmed positive case of COVID-19. So that is 2 cases within the SNF. Her 40-year-old daughter, the daughter of the 87-year-old, visited last week. So what do you guys think? Just another minute. Okay, I guess this was a tricky one for people. So we can stop the poll. And so I think that in the context of a skilled nursing facility, again, we kind of talked about this is a setting where there are a lot of older and medically vulnerable people who are at risk of severe COVID-19 disease. The definition of a COVID-19 outbreak reflects that, and the number that we require is lower. So I would say yes, this is a COVID-19 outbreak. You have that we have a confirmed case, and that that there is another person who is linked, who is identified as a close contact. Okay, next slide. Okay. Another Zoom poll. Is this an outbreak? Okay, so I think we can launch this one. So at an Evanston school, there are 3 students at 3 different learning pods, all of whom test positive. Would you call this an outbreak? Okay, great. I think most people have answered. We can stop. Yes, so I would call this an outbreak because despite the fact that these kids are supposed to be cohorted or separated into different pods and not interacting with each other, we know that kids and adults, are not perfect at following rules. They're linked epidemiologically by their setting and the school. So yes, I would say this is an outbreak. Okay. Next. All right, I think this is our last one. So is this an outbreak? A staff member who works in food services in middle school tests positive for COVID-19. A month later, no new cases have been identified. All right, and I think we can probably stop the poll here. Yeah, and people do not think this is an outbreak. I agree. There's a single staff member in that setting. with no additional staff or students who are identified within a 14-day period. So this is not an outbreak. Great. All right. So we're gonna end by reminding ourselves that outbreak is sort of a general term that means more than an expected number of cases at a particular location, that it's very contextual, but that it depends on the setting, and we talked about some of the criteria used to establish the presence of COVID-19 outbreaks in the different settings that we're concerned about. We talked a little bit about the most common sources of data from which COVID-19 outbreaks can be detected. And we described sites' COVID-19 reporting requirements to CDPH, as well as to local health departments and other agencies.